Webinar starts.
Welcome. My name is Paul Burstone. I'm the chair of the Social Care Institute for Excellence. Welcome to, I think, the 130 odd people that so far have joined this webinar. This is the second of a series of webinars that SCIE has organised as part of our response to COVID and to cover a range of issues that are emerging as we make our way through the pandemic. Really pleased today that we're going to be focusing on the implications of the Coronavirus Act, which is the act that gives the government additional emergency powers, and particularly those parts of that legislation that deal with the Care Act and have the effect of changing some of the ways in which the Care Act might apply. And I'm delighted to have two colleagues who will be joining us during this webinar to help us navigate this territory and to contribute more generally to a discussion about the sector's response to the COVID crisis. I'm very pleased to be joined by Clinton Farquharson, who is the chair of Think Local Act Personal, and also Alex Fox, who is the chief executive of Shared Lives Plus, and also a trustee of TLAP itself. So really pleased to have both of them join this call. I think we're sorting out one or two technical issues with Clinton, so hopefully he'll be joining us shortly, but I know Alex is already on the line. What I wanted to do first, before I come to Alex, is just sort of say a few words about where we are with regards to the emergency powers and the changes that could be brought in by local authorities to the way in which they apply the provisions of the Care Act. So just really the first thing to say is this curious term has been used as part of the legislation that's been brought forward called the easements. And one of my colleagues thought it would be no bad thing if we put up a definition of what an easement means. I'm not entirely certain that the definition necessarily gives us any more clarity. I think the upshot of this is that this is a provision in the legislation to allow local authorities under certain circumstances, and I'll come back to those in a moment, to effectively no longer exercise certain parts of the Care Act, that they become powers, which means they're permissive for the local authority to choose whether to use them or not, rather than duties, which are the must-do things that local authorities have to do anyway. So it's an easement that's being talked about. The second thing really to sort of say is that there's quite a bit of guidance already out there. When the legislation went through Parliament, subsequently the Department of Health and Social Care published on its website the guidance that we refer to there. And it does make it very clear in that guidance that local authorities should do everything they can to continue to meet their existing duties prior to the Coronavirus Act provisions coming into force. And it's just worth saying that those provisions kicked in from the 31st of March. But I think from certainly conversations anecdotally that I have had with directors of adult social services, there is a view that actually the additional sort of responsibilities around recording and reporting when you choose to use these easements are such that for many, the idea of then unpicking all of that later actually puts local authorities off using the powers in the first place. So just to say a little bit about those what the guidance covers. It covers really three main things. It talks about what local authorities no longer have to do. For example, it turns the duties around assessment of need into a power, so local authorities can choose not to apply the legal provisions there. And also another example would be around charging. I think it's worth saying, though, that it also says those things that are remaining unchanged by this legislation. One of those is the well-being principle, which is at the beginning of the legislation and is an overarching duty on local authorities when exercising any of their powers or duties under the Care Act. They have to have regard for, take into account how they promote individual well-being, and the legislation sets out what that means. But I think that's a very important protection when it comes to the way in which any easements might actually be applied. It also, in the guidance, makes very clear that if local authorities do take this step, and I think it does recognise in the legislation and the guidance that this is not in no way a small step for local authorities to do this. They have to document why they've decided to do that. And the sorts of examples given for that would be a situation where the numbers of staff available to provide services had significantly reduced, presumably because of sickness caused by the virus and other problems, or where demand has gone up significantly. And I hope on this call we can gather from some of you examples of where those things are happening, and it would be great to get your questions and your own experience of how the Care Act is being applied during this time. And as I say, the final thing is that local authorities have to record whenever they take these decisions, and they have to evidence how they don't compromise the rights under the Human Rights Act legislation as well. Moving on swiftly, I think the other thing the legislation also says, the guidance says rather, is that at the beginning of the pandemic, the chief social worker at the Department of Health and Social Care published an ethical framework to guide local authorities and social care practitioners through this period, and set out a number of issues, so really in terms of responding to the crisis. And that list there of 8 key ethical principles is set out in the guidance. It's available on the website. I would sort of commend it as something to refer to. And again, local authorities have been told very clearly in the guidance that were they to wish to exercise any of the easements, then they would need to demonstrate that they were doing that in the context of the ethical framework. Again, I'd be very interested on this webinar for anyone who has had experience of doing that so far to post any comments. I think the final couple of things I just wanted to say were to refer to the work that SCIE has been doing with the Department of Health and Social Care. Just this week on Wednesday, the Department of Health Department of Health and Social Care published its action plan in response to COVID for social care. I think many of us in the sector feel that whilst it might have been welcome, it was rather belated recognition of the extent of the pressures on adult social care services up and down the country. And that plan sort of sets out 4 things that it wanted to give particular focus to, particularly around controlling the spread of infections. Secondly, about supporting the workforce. And thirdly, about providing support for individuals, either people at the end of life or people who need support to maintain their independence. And then finally, supporting local authorities and care providers. And SCIE is playing a part in supporting some of this action plan. But I think also we have been critical of some omissions from it, not least that it doesn't say anything specifically about safeguarding, which we think is a real cause for concern. And it also possibly doesn't do as much as we could be doing to make sure that good practice is being rapidly shared around the country. And just a final thing to say is in terms of the things that SCIE is doing to support this action plan, we're bringing partners together virtually to share best practice. We're developing good practice resources. We're supporting adult safeguarding boards. We're working with colleagues at the Local Government Association and the Association of Directors of Social Services. And we're producing a variety of resources. Again, we'll be very pleased to receive any suggestions or thoughts that colleagues might have of what could be helpful going forward. And if people use our website to do that, that'll be great. I think without...
Good afternoon, everyone. My name is Clinton Farquharson, and I'm the TLAP Chair and a member of the National Co-Production Advisory Group. In these moments of flux, we have the ability to reshape what the new norm will be through our response, recovery and reform. This is what TLAP have been considering. Thanks, Paul, for the opportunity to talk about this. The first point I would like to make is that TLAP is thinking about the pandemic in 3 overlapping phases. Responding to the crisis, where we are now, and hopefully we'll turn this corner soon and enter a recovery phase. Not back to business as usual, but focusing on building a picture of the experience and impacts on people with care and support needs of the pandemic and contributing to a third phase. And the third phase should be about using the lessons learned to inspire, inform the social care reforms so many of us want to see. A fairer system built on personalisation, co-production with a strong community focus, just like the Care Act was meant to be. TILAP's concerns right now in this crisis phase is about the Care Act easement. As the pandemic took off, we were concerned about what this would mean for people accessing care and support. When we first heard about the Care Act easement, even more so. We didn't start from a great place, as we know. The track record of the Care Act implementation is patchy at best. Many disabled people are fearful over the loss of hard-fought rights to independent living. Not disguising this reality, TILAP took the view that we should constructively engage with the process for producing the Care Act easement guide, intending to assist councils in deciding whether or not to switch on the easement alongside the ethical framework. And to their credit, the Department of Health and Social Care approached the drafting of the guidance in a collaborative way. TILAP and TILAP partners such as ADAS, Local Government Association, and the National Co-Production Advisory Group, and many others, were able to contribute their concerns and suggestions. I would say we won some and lost some. Most important for me, we successfully made the case for the statement on continuing to put people with care and support needs at the centre. Can I ask Steve to show the TILAP statement slide, please? The statement highlighted the importance of sticking to the principles of personalisation and co-production. I'm particularly pleased that Making It Real was cited as a reference point. For those of you who don't know Making It Real, it describes what good personalised support looks like by using the I and we statements. It also found its way into the COVID-19 Adult Social Care Action Plan. It represents a North Star, difficult to see at the moment, but a star we must not lose sight of. I know at one level these are just words, and we would want to see them translated into action. What they make clear is that the crisis should not be an excuse to drift permanently away from the Care Act. This gives me hope, and we need that more than ever right now. Direct payment recipients, self-funders, and personal assistants, and family members and carers will absolutely understand the unprecedented demands that the pandemic is placing on the care and health system. It's also fair to say that it is placing many demands on people who hold direct payments. The initial national response has not paid enough attention to the estimated 210,000 people with direct payments, including 80,000 people who employ their own personal assistants, TILAP and the National Co-Production Advisory Group, and other partner organisations like In Control, Disability Inclusion London, and many more have been fighting hard to get this change. fighting the case for personal assistants to be classified as essential key workers. PPE is made available that people should be able to use their budgets flexibly and may need to spend more to stay safe and comply with self-isolation and social distancing. There is now some national guidance, specifically on direct payments. We want councils to follow the guidance, and what TLAP is doing in response through to recovery phase. The TLAP partnership is responding in a number of different ways. One, proposing that our board meets more regularly so we can gain insights on what is happening on the ground and feed this into the national COVID-19 structures and share good practice between partners. Two, members of the National Co-Production Advisory Group are collating stories of people's experience, good and bad. Three, we are working with the Care Quality Commission to see if we can develop a Making It Real app so that we can get real-time feedback from people accessing care and support on the quality of their support. This is an exciting development and fantastic example of moving from recovery to reform. If you want more detail on direct payments, we are finding out about both good and bad experiences and examples of good practice. And for example, a National Co-Production Advisory Group colleague who was advised to self-isolate early on is using direct payment flexibly and creatively to keep himself safe and well. And according to him, his support is the most personalised it's ever been. He's confident and assertive, not afraid to stand up to his council. Other people I know are fearful of making changes as they are worried about what their local authority will say. On the flip side, we're hearing about councils who are doing the right thing by providing good information and support to direct payment holders. Places like Nottinghamshire, Doncaster, Hammersmith and Fulham, Essex, even my own Birmingham City Council is doing some of this. We are capturing the good practices so it can be shared and others can follow. TLAP and reform. Out of the dreadful time, we must make sure to bottle the good stuff and what is happening and learn from the bad stuff and make sure it's used to build the momentum to drive forward with the urgency to create a better social care future. For example, there is an emerging evidence that the virus is hitting people from Black and Asian minority ethnic communities harder. From TLAP's perspective, we will be working with our partners to understand why and act upon the implications for personalised and community-based support. Two, we will use the positive examples and experiences to get self-directed support back to its roots, allowing people genuine control and choice and flexibility. This is not just about direct payment recipients, but for everyone, whatever the type of care or setting. As my colleague Anna Severite from the Coalition for Collaborative Care has called for, there must be a bonfire of bureaucracy replaced by relationships that trust people and families to do the right thing. And the third thing, for direct payment holders, we have to pursue the case for ending the inequity on the cost of care, whereby hourly rates are allocated to direct payment holders are less than the commissioned home care. Direct payment holders also deserve a pay rise, as many have not seen an increase in their budgets, some for many years, We need to put this right and see it as a fantastic opportunity to grow the numbers of people who want to take on a direct payment and the numbers of people who want to be personal assistants. This will also mean investing in disabled people's organisation, many of whom have lost the funding. 4. As we all know, we have seen communities stepping up to provide mutual aid. This is brilliant, but we need to learn the lessons on how this can be sustainable once people go back to work and school. How the national and local government can harness and support local community support without exploiting it and trying to control everything. All of this and much more besides gives me hope that we can learn lessons in quick time to help us to move closer to the realising the well-being principle in the Care Act and beyond. A fairer and more inclusive and co-produced future must be our shared goal. Thanks, Paul.
Absolutely right to be sort of focusing on not just the here and now response, important and essential though that is, but also we also need to cast our minds to the future. I think what social care does not need after the pandemic is yet more patch and mend. It needs reform. It needs those principles of the Care Act to actually be put into practice and the resources to actually enable that to happen. So I think that's a very powerful call from you and from TLAP on that front. Now, I'm really pleased we also have Alex Fox, who is Chief Executive of Shared Lives Plus. And I think in that sense, very much at the sort of sharp end of supporting those that are providing support and care in the community. And it'd be really good both to get your perspective on how you're seeing things on the ground and seeing things nationally, and perhaps also this discussion about how the Care Act is made a reality and how we safeguard its good intentions against the easements that are being proposed. Over to you, Alex.
Thanks, Paul. Hopefully people can hear me at about the right level. I know there's been some issues with sound. So I'm coming at this from the perspective of both supporting our members who are the UK's shared lives and home share organisations and about 10,000 shared life carers providing care for people in their own home. But also thinking more broadly, we're part of the Care Provider Alliance, which are all the bodies representing care providers. So that's the community sector like ourselves, but also care homes and home care. And there's a huge amount of work going on, as you'd imagine, with government and the sector to try and address the current crisis. So at the moment, it's impossible to ignore the desperate situation that a huge part of the social care sector is in right now. And we are seeing, as I think we sort of started to touch on already, both the best and the worst of both social care, but how that reflects our attitudes towards older and disabled people in this country. So just to not to ignore the worst, we approached this crisis expecting it to infect large parts of the population, knowing it was going to be extremely dangerous, particularly for older, frail people. And without, it feels, a real plan in place for the protective equipment and the testing that would enable people, the younger people who were going to have the virus, to safely care for the older people who absolutely need to be protected from it at all costs. And the last few weeks have involved a huge amount of activity trying to address that problem. So for many social care providers across the sector that we're hearing from, they still don't have the PPE they need, and testing is still in its infancy. And there is an unfolding crisis, which I think is going to dominate a lot of the thinking and what we hear about social care over the next few weeks. Having said that, we're also seeing some of the best as well. So the huge outpouring, as Clinton touched on, of people supporting each other, people not waiting for permission, just reaching out to their neighbours and helping each other. 750,000 people signed up to volunteer for the NHS and social care. And in our part of the sector, we're seeing huge creativity and resilience. And I think that that resilience can be found across the sector as well. So social care has been historically underfunded and hasn't had the national strategy it's needed for years and years, and that's created a crisis in many areas. It's also created some huge resilience, and we are seeing people doing whatever it takes to keep people safe and well. In the shared life sector, we've got a model in which 10,000 shared life carers have been matched with an older or disabled person who has moved in with their shared life carer and lives as part of the family. And that model has proved pretty resilient because there's no staff team coming in and out of a household. People are able to self-isolate at home together. We're also seeing some pressures, and I think these would be reflected in the situation that family carers are facing as well. So shared life carers would usually be supporting somebody who was using day services, which are now all closed. So now they're trying to provide support in their own homes 24/7. So that's meant that there's been pressure on behaviour support, for instance. And one of the things that's been really striking about our experience of this crisis is we've known that positive behaviour support for shared life carers has been an issue for years and years. It's not been something we've been able to resource. Within about a week of lockdown, we had government backing and a partnership with Build, the British Institute of Learning Disabilities, that put in place a national behaviour support helpline. So there is that sense that we are addressing things. That's one small example, but showing that we can address things at pace, including things that have been issues for the sector for a long time. And so thinking into that reconstruction period that Clinton was talking about, we need to be able to capture that creativity and some of the ways in which people have been freed up to be pragmatic and to get things done, and to bring that together with the outpouring of community and people wanting to support each other to create a completely different core model of social care that's much more based on the expectation that people will live in their own homes, that they'll be able to get really flexible support that will work with their natural support networks, their families and friends and the communities. And that is going to feel very far off for a lot of people at the moment because of the crisis that many people are in. But that has to be our goal. And I think, as Clinton says, it's a star that we can't take our eyes off. Even though things feel pretty dark in a lot of the sector at the moment.
Thank you very much, Alex. And I think that North Star point that Clinton's made and you've just underscored is a very powerful one. And certainly I believe that too, that that wellbeing principle of the Care Act is really, in a sense, both the aspiration and the intention of what we're trying to deliver here. Now, I've had a few comments and questions I can see coming up on the chat. So I wanted to sort of start to sort of try and make sure we'd picked up on some of those. And can I just say to those that there's 207 colleagues on the webinar at the moment, if there are points and questions, please do type those in, and we'll either try and answer them during the call, or if otherwise we'll try and pick some of them up through materials that we publish on the SCIE website. And the first thing I wanted to just pick up was a question from Rachel, which I think I've seen answered by Caroline on the responses, but was directed at you, Clinton. It was really about the role of advocacy when it comes to individuals who might be finding it difficult to deal with the powers that be. So very much, I think your point of the sort of differential experience of people using direct payments, some feeling very empowered and able to redesign what they need to meet their current needs, others feeling very fearful of what the local authority would say. I just wonder what your thoughts were about the role that advocacy can be playing at the moment, Clinton.
The role of advocacy is very important, and it's in my own in Birmingham, we've set up online.
Clinton, can you get it a bit nearer to the microphone or something? I think you are very, very quiet on this occasion.
Can you hear me? Hello?
I can. I think everyone will just need to turn their speakers up to full volume so they can hear you.
I think advocacy is a really important question. mechanisms that those people who are so fearful, I know online, how are we using social media in this time? We used to run a peer support group face to face, but we've had to move online, and what we're trying to do is support each other through this. But advocacy is really important, and I would ask advocacy groups to try and create new ways of trying to get the seldomly heard voices to the forefront.
Thank you, Clinton. I'm very conscious that it feels as though you're not so much in Birmingham as on the moon, I think, because it does sound like a very long way away. Thank you. I think we could pick that up. I think another question I've just seen from one colleague was about really this challenge of the opportunity, if one can put it that way, in the future around reform. And I think the sort of challenge back is how do we actually do that? How do we make sure that social care gets a hearing when the public begin to turn their minds to other issues like the economy and so on? Alex, I wondered if you had a view on that.
Yes, and there's been a lot of work that Think Local Act Personal and Social Care Future have been doing around how we reposition social care in the public's mind. Because for years now there has been a sense, firstly, that the public didn't really understand what social care was, and I think we can see the results of that in the current crisis, because really social care should have been at the forefront of planning for this crisis, and it's felt at times like it's been an afterthought. So that's been a huge problem, I think, and at the moment, I was just outlining how there is a very real crisis in our sector, which we can't ignore. What that's done is it has brought social care, I think, much more sharply into focus for many people. Many people are now aware that there is a huge issue there, and so we need to be able to pivot from where we are to presenting a form of social care that people will see as part of the future. So I think we need to be able to move beyond simply fixing the problems with what we've got to creating a new vision for a kind of social care which feels like it's relevant not just now but in the long term, and that feels relevant to all of us. So we often talk about wanting social care to be as recognised and loved as the NHS. I think I'd probably settle for social care being as recognised and loved as education. So the education system is something that we all see as indispensable, even though it's not with us all the time. It's there at different parts of our lives, and at any one time there's probably somebody in our extended family that's using the education system. I think we need to get to that point with social care where people recognise that this may not be me right now, but it's probably somebody in my family now, and it's certainly me at different times in my life. And then we have to be able to demonstrate and highlight the models which are providing people with a good life. Because really what people are looking for is the thought that I will be able to grow old, or I'll be able to live well with a long-term support need. And that won't just be basic support that keeps me alive, it will look like a good life. And there will come a moment after this immediate period of lockdown and the immediate crisis has passed, where we're needing to think long term, because we're going to be at the beginning of a very long recession, I think, a very deep recession. We're going to have lost some good organisations, we're going to have lost infrastructure. We're going to be in a position where we have to build something. And I think it's vital that we don't just rebuild what we have, but we build something which people will then start to love and value, like other public services.
Thank you very much, Alex. And I think that sort of notion that social care is at least seen to given the same status as education, is an interesting one. I see that Lynn Bowers has posted a question about where we are with the social care green paper. And if I'm smiling at that, it's not because I don't think it's a serious question and a serious issue. I smile because the green paper has been in the making for so long now. It's well past being green. I think the honest answer is, post this crisis, I hope we don't have a green paper. I hope we have something that's far more specific and far more urgent in desire and intent to deliver a reformed situation for social care. I think we need to make sure we don't throw the baby out with the bathwater. I think there is a real question for me about how we really embed the well-being principle in all that we do, and how we do that in a way that really draw some of the positives out of the last few weeks. So looking down the list of things that people have said, just coming back to this question about direct payments, which I know, Clinton, you raised, but I'm going to come to Alex first, but come to you in a moment. I note on the chat that Essex is apparently reviewing its direct payment rates. It'd be interesting on the chat to see if anyone else has got any experience of places that are actively looking at the rates they're actually paying. But Alex, I just wonder what your thoughts were on the adequacy of the rates of direct payments and the flexibility around them.
So I think there is an issue with the rates having fallen behind. The social care sector in its provision is so various now, both in terms of the models, which range from, through care homes, home care, shared lives, supported living, but also then, of course, people employing their own personal assistants. And I think it's the parts of the sector get left behind and forgotten about. So rates of pay fall behind, and there isn't a strong enough voice for people who hold direct payments, even though that now is, I think it's about 250,000 people. It's a really large number of people spending a really large amount of public money. I think equally important is the flexibility that people need. And I talked earlier about the fact that in some parts of the sector, we're seeing some ability to be really creative and flexible and change things very rapidly. That hasn't been extended to direct payment holders, certainly not in every area. So we've seen over the past few years a gradual erosion of some of the freedoms of direct payments and a creeping back in of bureaucracy. And at the moment, it's literally a matter of life or death for some direct payment holders that they have the freedom to spend that direct payment as they see fit. And so Think Local Act Personal has been recommending that that people are able to vary their care package and inform the local authority rather than be expected to get something signed off by a local authority at a point at which local authorities are least able to process and those kinds of requests. So there's obviously local discretion there, but I think we should be trusting people to make good decisions, keep the local authority informed. And I think the risk of somebody misspending or not spending as well as they should do their own direct payment is relatively small compared to the risk of them not being able to put together a safe care package and there being disastrous consequences of that. So again, I think this is one of those areas where we need to be pushing for personalisation, independence, choice right now, rather than seeing them as needing to be kind of casualties of this war against an infection that we're in. And then we need to be pushing harder on them after the crisis, because that they are the way in which people can adapt to their very personal circumstances. And a lot of the problems that we're experiencing in the provider sector are the difficulties of government trying to produce a clear position statement for people's very individual situations. And there is an element at which people need to be trusted and empowered and supported to create their own good life and their own good social care.
Thank you very much, Alex. I'm going to go to Clinton, just maybe to sort of pick up on that. I'm looking at the chat. There's quite a bit about direct payments coming through in terms of what appear to be sort of very much a sort of individual response to requests for reviews and so on. So some flexibility, but not a blanket approach. I just wondered, you'll need to turn up. People need to turn up their speakers so they can hear Clinton. Clinton.
Being flexible, but the real problem about direct payments and being creative and flexible is local authorities implementation of direct payments, and how the understanding of what it really means around choice and control and independent living. These are not nice to have, that they are fundamental to as Alex talked about, a good life, and people's thinking of how they use direct payments. It's more than a service, it's a life, it's a way to be connected, to feel belong that in your community. And it's how creative local authorities can be about making that happen.
Thank you, Clinton. And I think the point I would make on that, let me just turn off your microphone. Yes, the point I would make about that is, as was said earlier, the numbers of people now that are in receipt of direct payments are large, but they are still not registering, I think, on the radar in terms of the national coverage around the crisis. I think we've seen this week social care get some recognition with the publication of the action plan, but I think we all have more to do, and I would certainly say SCIE, working with TLAP and others, have a lot more to do to make sure both government and the media are focusing on this group as well, to make sure they are getting both access to the resources they need during the crisis, but also then are not forgotten as we come out of the crisis. And I think one of the things that also we need to be keeping in mind, many people within the direct payment community will be in what are described as the shield and sustain part of the population that are being told to stay safe at home, probably for longer than the whole community, and making sure that there is the right support, not just for the here and now, but actually for a longer period, is really very critical to that. I wanted to come on, before we get towards the wind up at the end of this hour, to a question that Karen raised, which partly I think you've touched upon already, Alex, but I just think it'd be worth saying a bit more about it. And that was the sort of longer term funding implications for the social care sector, the provider sector, sort of going forward. And I think the sort of issue that she's raising in her question is really, how do we make sure that there is a real understanding of some of the sustainability and viability issues that are currently, in a way, masked by everyone responding to the crisis. And I would just observe that we have a lot of very small scale businesses that provide care and support in this country, a very fragmented care sector. And some of those businesses may struggle as we return to normal to actually continue to be viable. And we need to make sure we're identifying and putting in place the right support as appropriate to that. So I'd be interested to get your thoughts on that as well, Alex.
Yeah, I think there will be providers at risk right across the sector. We've seen in recent years as well some of the really big providers going bust, and so there will certainly be some providers who will struggle or who won't make it, and it would be a tragedy if we actually lost all of the small providers. CQC consistently finds a correlation between providers being small and them being, on average, higher quality. That's not to say, of course, there aren't lots of exceptions to that. That's not a hard and fast rule. So you can see several scenarios playing out. One is that the public loses interest again, and that social care kind of returns to this endless cycle of green papers, which all come up with answers that government doesn't really like. Another is that there is just some move to merge with the NHS, and I think there's already been sort of commentators making those kind of noises, which again happen from time to time, and which would be a very double-edged sword, because the last thing we need is a more medicalised model of social care going forward. And then there is the potential for a future in which the public starts to understand and value the idea of everybody being able to live good lives at points in their life when they need long-term support, and where we can show them as a sector what that looks like and demonstrate that we can achieve that. And it's one of the ironies, I think, that social care is often, as much as people sort of understand it, they often hear about it as a problem. It's one of the sectors, we are one of the sectors, I think, where there's been the most innovation over the last couple of decades. There's been huge transformation within social care, some really radical new models. So we're part of the Social Care Innovation Network, which has been slightly interrupted by this crisis, but was bringing together 15 areas that are innovating, a similar number of organisations like Shared Lives Plus and others, which are taking a much more community-based approach, much more personalised approaches to care, and asking what would it look like if we made that different way of thinking, that much more community-focused, personalised, asset-based in the jargon way of thinking, the core of a new model for social care. We can't lose sight of that. We need to take stock of what that will look like in the new world. But it does have to be the core of the new world. And I think if we can do that, then we can be optimistic about breaking free of this cycle that we've been locked in for years and years now of underfunding, constant crisis, and a sense that this is a problem that can't be fixed.
Thank you very much, Alex. I'm going to come to Clinton really just for some last words on this discussion about the CARE Act, about the immediate response, and about the future. And then I think we'll be bringing the webinar to a close. So over to you, Clinton.
I just think people need to remember we're talking about human relationships. It's about our feelings, our emotions, but it's also what direct payment recipients and PAs, what we want. We want people to act. Don't just listen. Act and do something so you show that you care. Also, the language is still a really important how we're being described. Sometimes I'm still hearing the language as service user, and the power dynamics in that is we're not passive recipients of service. There has to be constantly banged on, and we also need to and I think we're challenging where the power is held. When we come out of this, there's certain things that won't go back and go back to business as usual, and people need to remember that the power is being moved and shifted. It's not where people think the power is being held.
Thank you very much. I think that's a very good challenge at the end there about the importance of relationships and that care and support and enabling people to have the life they want for themselves is really fundamentally about relationships. And I can't help but think a little bit. Been rereading some of the stuff at the end of the Second World War, and I don't like wartime analogies for fighting a virus. It's a very different thing, but I think there is something we can take from the fact that during the Second World War, the government commissioned Beveridge to do the work that laid the foundations for our current social contract and welfare state. And one of the things he said at the end of his report, which I think is incredibly appropriate for where we are today, was that after, as we were coming towards the end of the war, that what was now needed was time. It was a time for revolutions, not a time for patching. And I think that is absolutely true after nearly 70 years of patch and mend for social care. That is one of the legacies of this time. And in a way, it's a legacy born out of the experience of our communities. The fact that people every Thursday have gone out and clapped for care workers, the fact that people have volunteered in huge numbers to contribute their time as volunteers, and many other examples of that sort of mutual support and mutual aid, I think is part of what might be the future. And talking about the future, I just wanted to end by pointing to SCIE's plans for future events. We're very keen to get your views about what would be helpful in this sort of series of COVID-related webinars, things that you would find helpful to be discussed. But the next webinar that we have organised coming up in just over a week and a bit's time on the 28th of April at midday is a webinar in which we have Kate Taroney, the Chief Inspector of Adult Social Care, along with the new incoming Chief Executive here at the Social Care Institute for Excellence. And I hope on that call we can both talk about some of the issues that you've raised in the chat today about bureaucracy and regulation, and also we can explore how we make sure that co-production and asset-based ways of working are supported by the way in which our regulator does their job as well. But I think I would just end by saying thank you all very much for joining and sticking with us through all the technical problems that we seem to have during these webinars. I'm pleased that at least 170 people are still with us at the end of this session. We have done a recording of it that will be posted on the SCIE website and available for people to listen to and play back at their leisure. But again, my thanks to both Clinton and to Alex for joining us on this webinar today, and my thanks to the team that have helped us put it on the airwaves. So thank you all very much. Have a good afternoon, have a good weekend, stay safe. Thank you very much.